1. A client reports frequent panic attacks in crowded places and avoids going to the supermarket. Which diagnosis is most consistent with these symptoms? A. Agoraphobia. B. Generalized anxiety disorder. C. Social anxiety disorder. D. Obsessive compulsive disorder. 2. Which of the following is a primary goal of cognitive behavioral therapy, CBT? A. To explore unconscious motives. B. To restructure maladaptive thought patterns. C. To increase catharsis through expression. To strengthen the therapeutic alliance exclusively. 3. When a counselor conducts an intake assessment, the most important initial step is to A. Establish rapport with the client. B. Create a treatment plan. C. Interpret test results. Assign a DSM-5 diagnosis. 4. Which ethical principle requires counselors to avoid actions that cause harm to clients? A. Fidelity. B. Non-maleficence. C. Justice. D. 5. A licensed professional clinical counselor is legally required to break confidentiality under which circumstance? A. When a client expresses dissatisfaction with therapy. B. When a client is at imminent risk of harming others. C. When a client requests a copy of their records. D. When a family member asks about the client's progress. 6. In multicultural counseling, the term cultural humility emphasizes A. Knowing every client's cultural background in detail. B. Maintaining an attitude of openness and lifelong learning. C. Using standardized cultural assessments exclusively. D. Prioritizing counselor values over client values. 7. Which therapeutic approach is most associated with unconditional positive regard? A. Cognitive therapy. B. Person-centered therapy. C. Behavior therapy. D. Gestalt therapy. 8. Which of the following assessment tools is specifically designed to screen for depression? A. Beck Depression Inventory, BDI. Minnesota Multiphasic Personality Inventory, MMPI-2. C. Generalized Anxiety Disorder, 7-item scale, 7. D. Columbia Suicide Severity Rating Scale, CSRS. 9. A counselor is treating a client with alcohol use disorder. Which intervention is evidence-based for relapse prevention? A. Motivational interviewing. B. Psychoanalysis. C. Systematic desensitization. Gestalt empty chair. 10. Which concept refers to the emotional reactions a counselor has toward a client? A. Transference. B. Countertransference. C. Projection. Reflection. 11. A client states, I feel worthless and hopeless every day. The most immediate clinical concern is A. Potential suicidal ideation. B. Relationship dissatisfaction. C. Sleep disturbance. D. Family conflict. 12. Which of the following is considered a key element of trauma-informed care? A. Encouraging clients to re-experience trauma in detail. B. Prioritizing client safety and empowerment. C. Using confrontational techniques. D. Focusing solely on diagnosis. 13. A counselor who fails to obtain informed consent from a client is violating which ethical standard? A. Confidentiality. B. Competence. C. D. Informed practice. 14. Which of the following best illustrates an evidence-based treatment for PTSD? A. Dialectical behavior therapy, DBT. B. Prolonged exposure therapy. C. Reality therapy. D. Adlerian therapy. 15. In group counseling, which factor is most associated with positive therapeutic outcomes? A. Group cohesiveness. B. Confrontation. C. Leader self-disclosure. D. Uniform group membership. 16. Which of the following is a primary focus of solution-focused brief therapy, SFBT? A. Exploring childhood trauma. B. Building on client strengths and resources. C. Analyzing unconscious motives. D. Emphasizing diagnostic labels. 17. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, is primarily used for A. Developing treatment goals. B. Classifying and diagnosing mental disorders. C. Conducting career assessments. D. Measuring therapeutic alliance. 18. Which stage of the trans-theoretical model involves a client planning to take action within the next 30 days? A. Pre-contemplation. B. Contemplation. C. Preparation. D. Maintenance. 19. Which type of validity refers to how well a test measures the theoretical construct it claims to measure? A. Construct validity. B. Content validity. C. Criterion validity. D. Face validity. 20. Which of the following is considered an ethical boundary violation? A. Accepting small tokens of appreciation from a client. B. Engaging in a romantic relationship with a client. C. Using supervision to discuss countertransference. D. Referring a client to another specialist. 21. A counselor who integrates techniques from multiple therapeutic approaches is practicing A. Eclectic therapy. B. Humanistic therapy. C. Behavioral therapy. D. Classical psychoanalysis. 22. Which federal law ensures client rights regarding the privacy of medical and counseling records? A. FERPA. B. HIPAA. C. ADA. D. ACA Code of Ethics. 23. In crisis intervention, the counselor's first priority is to A. Gather detailed psychosocial history. B. Ensure client safety. C. Administer a diagnostic test. D. Develop a long-term treatment plan. 24. Which of the following is the most appropriate response when a client expresses suicidal ideation? A. Immediately reassure the client they will be fine. B. Conduct a suicide risk assessment. C. Ignore the comment to avoid reinforcing it. D. Encourage the client to distract themselves. 25. Which theoretical orientation emphasizes the client's drive toward self-actualization? A. Person-centered therapy. B. Cognitive therapy. C. Behavior therapy. D. Family systems therapy. 26. Which term refers to the belief that clients have the capacity to resolve their own problems with guidance? A. Suffocacy. B. C. Locus of control. D. Self-concept. 27. When conducting family therapy, the counselor primarily focuses on A. Individual pathology. B. Interpersonal dynamics and communication patterns. C. Diagnosing each family member. D. Exploring unconscious drives. 28. Which test is most appropriate for assessing personality structure and psychopathology? A. E2. B. C. Beck Anxiety Inventory. D. Stanford-Binet. 29. Which type of group therapy is designed for clients who share a specific problem, such as addiction? A. Psychoeducational group. B. Support group. C. Task group. D. Counseling group. 30. Which of the following is a core component of motivational interviewing? A. Expressing empathy. B. Assigning homework. C. Confrontation. D. Interpretation of dreams. 31. Which of the following theories emphasizes irrational beliefs as the root of emotional disturbance? A. Rational emotive behavior therapy, BT. B. Gestalt therapy. C. Person-centered therapy. D. Adlerian therapy. 32. A counselor who conducts research must ensure which ethical principle is followed first. A. Fidelity to participants. B. Informed consent. C. Confidentiality. D. Justice. 33. Which of the following is a key indicator of burnout among counselors? A. Increased empathy for clients. B. Emotional exhaustion and depersonalization. C. Greater commitment to work. D. Improved problem-solving skills.